afternoon. I am Dr. S Pathak, retired professor and head, Department of Medicine, Kalyani Medical College, West Bengal. I am going to talk on Cardio Renal Syndrome. In fact, any pathophysiological abnormality of the heart will impact the kidneys, and reversely, gross abnormalities of the kidneys, particularly end-stage renal disease, and patients on hemodialysis will have effect on the heart, and that is called cardio-renal syndrome. In fact, there are 5 types of cardio-renal syndrome. One is acute heart failure, giving rise to abnormalities of the kidneys. Number 1. Number 2 is chronic heart disease will affect the kidneys chronically, and that is type 2. In a similar way, acute renal failure, particularly end-stage renal failure, and patients on hemodialysis will have impairment of the heart, and this is called type 3. Type 4 is again acute kidney failure, and particularly patients on hemodialysis will have effect on the heart. About 30% of patients undergoing hemodialysis will ultimately develop heart failure. And 5th one is secondary cardio-renal syndrome, that is affection of the kidneys and the heart due to causes other than the both organs, and that is mostly found in sepsis. Basically, we will discuss the preventive measures of this cardio-renal syndrome in all the types, because treatment is not that much for this problem. Only thing is that you have to optimize the management of both kidneys and heart. We will have to use judicious use of diuretics, judicious use of vasotropic agents, and we will have to keep the balance between the doses and the effect. Thank you.